Okay, so topic, facelift. Let's talk about how a facelift isn't just a facelift. What do I mean by that? What are we actually trying to do in addition to just lifting the face? We're trying to maximize a triangle. We're TriMaxing. Let's talk about what that triangle is. Okay, we're going to use this example of a youthful face with good proportions. We've got this region here. That's the malar region, the malar eminence. We've got this here. That's the gonial angle, the back third of the jaw. And then we've got the chin here. That's the malar, gonial, genial angle together, creating a triangle. That is the MGG triangle. And we're trying to maximize the external appearance of that, the definition of that when we're doing a facelift to bring about not just a younger appearance, but more definition, more balance with the rest of the face, and something that the eye can really anchor itself to see a face as a beautiful, attractive, balanced face. Okay, facelifts. One of my favorite things, favorite among many favorites. Let's talk about one of the really specific goals of a facelift, right? It's not just lifting the face, but it's reshaping the face. And what are we doing when we're reshaping the face? We're triangle maxing. We're TriMaxing. How do you TriMax? Well, first of all, you need to understand what that triangle is, okay? So not a real human skull, just a replica. We've got the cheekbone here. We're gonna call that the malar region or malar eminence. We've got the gonial angle. That's the back third of the jawline. Then we have the genial region, basically the chin, the anterior third of the jawline. We're trying to maximize the external appreciation of a triangle that connects the malar area to the gonial area to the genial area back to the malar area. The facelift is designed, or at least a good facelift is designed to maximize that as best as is possible. That's TriMaxing. That's creating a really wonderful external appreciation, definition to the MGG triangle. There you go. All right, facelifts, facelifting. We're talking about TriMaxing, maximizing a really important triangle in the face. And that triangle is the MGG, the malar, gonial, genial triangle. How do we go about doing that? Let's talk about each one of these points independently. Let's talk about the malar region first, the cheek proper. Okay, so there's two ways we go about that. One is fat grafting. Often we need to do a little bit of fat grafting to the cheek. We add a little bit of fat here, a little fat here, a little bit of fat here, all dependent on the anatomy to create some more fullness there. But that's not the only thing. In that deep plane technique, we enter the deep plane here and we enter it here. And this tissue essentially is brought vertical. All right, vertical. And when it's brought vertical and it pivots here, it creates a little bit of fullness, what we call a standing contour enhancement from that pivot that really pulls tissue up onto the cheek. So again, when we're TriMaxing in a facelift, what we're doing is we're creating fullness for one of those triangles by fat grafting and the vector in which we elevate that deep plane. Eminence, which is that. Let's talk about the chin, okay? Now, the chin is really important. We need a nice chin to create a nice contour to the jawline, but also we need to have a nice chin in order to be able to suspend the soft tissues of the neck, because remember, every facelift is going to have a neck lift. How do we do that? How do we create balance and support in the chin? Well, there's two ways we can go about that. One is we can cut the bone and bring it forwards for someone who has a weak chin. Another thing that we can do is add a chin implant. That's something that's a more extensive conversation, which we can have later. But those are both things we can do during a facelift to help with that whole TriMaxing purpose that we want to bring about in our facelift. We've already talked about how we can enhance the chin, what we can do to address the malar region. Now we need to talk about the gonial angle. The gonial angle is the posterior third of the jaw itself. It really contributes to the jawline. It's what creates a distinction between the neck and the head, the face, okay? How do we go about enhancing that in a facelift? Just like in the malar region, there's two ways we do it. One is the way that we create vector shifts in the soft tissues of the face and neck lift flat, that deep plane tissue. And the other one is fat grafting. So we can inject some fat along here as part of the face and neck lift. That helps to maximize some of the prominence that we see in that gonial angle region. And then another thing that we do is that when we enter that deep plane, we're entering here, we're entering here, we're elevating all of this tissue beneath the skin, but what we also do is we have an extension of that plane of elevation into the neck underneath the platysma. And the way that we handle the resuspension of the facial tissue and of the neck tissue at the deeper level, the SMAS here and the platysma here, helps to maximize the appearance of that gonial angle. What we do is that we have a vector that goes straight up from the platysma into a region behind the ear, and we anchor it through that to the very thick, very strong mastoid fascia. I've pointed this out in surgery several times, and it's a very powerful procedure. The reason for that is that creating that elevation there creates a little bit of extra fullness. It's not really a bunching, it's just like a little bit of outpooching of that lower portion of the SMAS in a way, in the platysma, in a way that gives just a little subtle fullness there. And that little subtle fullness there interacts with the little subtle fullness here and the way we manage the chin in order to give us a really pretty triangle there that we're maximizing that M, G, G triangle.